Yeah, we want to come on. Yeah, okay.
Well, good evening. Glad to see this large crowd out. We'd love to see more, but we'll start where we're at. At this time, I'd like to call this meeting in order. We're going to start with an invocation, and then we'll do the Pledge of Allegiance. At this time, we want to make sure that we make it open. Is there anyone that would like to step forward and do a prayer? Mr. Fletcher, thank you.
Heavenly Father, we thank you for this day. We thank you for all things that have transpired during this day. We thank you for all the many blessings that you have restored upon us. And we continue to look towards the hills from which cometh our help. We ask that you bless us to live. Bless this town in which we live in and the citizens as well. We ask it all in Jesus' name and for us. Amen.
Amen. We could stand and place the flag, please.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this time, could we do a roll call of the committee?
District 1, Curtis Potts.
There.
District 2, Sara Browder. Here. District 3, Billie Goodson. District 4, Frank Fletcher.
Here.
District 5, Dwayne Craft. District 6, I am present. District 7, Arthur Brackett.
Here.
Chief of Police appointee, Rajiv Sharma.
Here.
Mayor's appointee, Marc Highsmith.
Here. At this time, we would like to move forward with the agenda. May I have a motion to move forward to accept the agenda?
So moved.
Second. It's been moved and properly seconded to accept the agenda. We'll accept the agenda by roll call vote.
Please respond aye or nay. District 1.
Aye.
District 2. Aye. District 3. District 4.
Aye.
District 5. District 6. Aye. District 7.
Aye.
Rajiv Sharma.
Aye.
Marc Highsmith.
Aye. The agenda has been approved. At this time, we will move forward to the approval of last meeting's minutes. Committee, many of you have had opportunity to review those minutes. At this time, are there any changes that are necessary? Okay, if there's no changes, we'll move. Can I get a motion to approve the minutes? It's been moved and properly seconded with the approval of the minutes. We will continue with the roll call vote.
District 1.
Aye.
District 2. Aye. District 3. District 4.
Aye.
District 5. District 6. Aye. District 7.
Aye.
Rajiv Sharma.
Aye.
Marc Highsmith.
Aye. Minutes have been approved. At this time, we would like to open up for public comments from anyone who is out there that would like to make public comments. The public comments are right now at 3 minutes. We ask that you come forward to the podium. If you have not signed up, there is a card there that we keep, because we want to make sure that the comments that are out, that we are able to, number one, receive those and then be able to contact you back with any clarification or get to the core of any matters that you have. Are there anyone at this time that would like to come forward?
Bailey, and I am the founder of Madison. And our mission is, we're a nonpartisan community group. Our mission is to get more civic engagement in our community. And I feel like your group is fantastic, and I want to make sure people see you. And so we have been recording, we recorded your first meeting, and I hope this evening that you all would make a decision to record your meetings, live stream your meetings, do whatever you can to get your message out there. I think that's just really important to engaging citizens. I know you would prefer them all to be in this room tonight, but that's just not possible. Myself, I'm a mother of 3 young daughters who weren't vaccinated yet, so it takes a lot for me to step into a room full of people that aren't necessarily, wearing masks and things like that. I know we're distancing here, but it was really like coming to this meeting and walking through the door to 5 police officers without masks on made me feel intimidated. And I don't think that's the message that you all are trying to send right now. I think you want people to come in and feel comfortable and not feel worried that they're going to take COVID home to their family. And so please take that into consideration and do that. We are going to continue to record these meetings, but I would really encourage you all to do it yourselves. I think that will build a lot into your organization and group, and I look forward to seeing what you all have to, what you're capable of, what you're going to be doing in the community, and however Madison can help you all to engage more. We're happy to do that, and I would love to talk to each and every one of you. So, thank you. There's no pen here to sign anything, so I don't know if I'm supposed to.
Okay.
I can do it after the meeting. If you want. I'll take it with you. Thanks.
Thank you. Are there any other public comments? Yes, sir.
Thank you, Jay. I'm George Kostakis with the Optimist Club, and I represent one of the 3 that we have in the Madison County area. I'm with the Huntsville Evening in Madison, and a lot of people have not heard of us yet. So regarding terrorist comments regarding exposure is very important. We've been around since 1919. Being a native of Huntsville, Alabama, we've along with one auto dealership in Madison. Hopefully get more dealerships in Madison because it pays for all the civil service. And things. I want to thank the police officers, law enforcement, and all the civil servants here in the area regarding today. What we do is we mentor youth to earn scholarships. And it doesn't matter what creed or what any other basis. It's that we do have 3 criteria to earn those scholarships. That's essays, oratorical, and also a golf tournament we sponsor. And the essays are usually due by January of each year. Oratorical. And these individuals, ages 10 to 18, can enter. Because now the kids are going to college at what? 15? On Zoom or wherever, so that's kind of cool. Class of 76 right here in the Huntsville area. And a teacher by background, and had some common names that they came up in 1957. I'm 57 classic, so I just wanted to welcome you to attend one of our meetings of your choice. There's one right here in Madison, and as well, the Huntsville Evening meets at 88 Buffet right there by Los Angeles, Burlington, over here off over here by the Mid-City. And we meet the second Tuesday of every month. It's 7 p.m. And dinner, hibachi and sushi and salsa rice cream is free. Guests and new members for a 6-month period. We meet once a month now during COVID, but we are face to face. But we're a hybrid too, so if you couldn't attend, you still we're trying to get somebody in each field. If anybody's heard of the BNI group right here in Madison, Business Network International, it's also an international company. They kind of get one person from each field. Maybe a realtor, maybe a car guy, maybe an insurance person, and I learned a lot from that group that kept me in, which I'm so terrible. So that'll be the 9th, second Tuesday in November at 7 p.m. 88 Buffet. If you'd like to learn more, or anyone else would like to join me, just get with me after the meeting. Thank you for your time. I'm George Kostakis. Hopefully you know for this 7 minutes.
Jocelyn Brower. I live in Taylor's Crossing, and I was not planning to speak tonight. My heart is heavy. Last time I was here, there were no police. Thank you for showing up tonight. I appreciate that. My daughter's birthday is October 27th. That's tomorrow. That is also the day of the Dana Fletcher shooting. It is very important to me. I did knock on doors. I ran for District 4. I saw the Blue Lives Matter flags on the back of the trucks, on the doors. Most of you all had rings on your doors. No one answered the door to me. None of the police did. I did talk to the last police chief. I talked to this police chief. My wishes are that the family can see that body cam. The mother of Dana Fletcher would like to see that body cam. She's been at city council multiple times. She's been in the mayor's office. I know she's spoken with you, Mr. Highsmith. And that's my wishes. And I believe there's a lot of people in the community that believe the same thing. And I think it's going to be hard to put this to rest until we can get at least the family, us all feel better about the family and where they're at. And again, I appreciate everyone's service. My heart goes out to how dangerous a job this is for you. Thank you very much.
Are there any more public comments? Any more public comments? Okay, seeing none, we'll move on in our agenda. We move to our district reports, starting with District 1.
No reports.
Thanks. Thank you, Kurt. Appreciate you. Moving to District 2.
Nothing to report.
Thank you, Sarah. Moving on to District 3, and Billy was not, obviously, he was not able to make it tonight, but he did give me a written report. And if you could just bear with me as I read through it for him. I regret not being able to attend tonight's session due to a business event that was previously scheduled for tonight. I did know of this conflict when we voted on our proposed meeting time at our first meeting. However, it was more important that we establish a consistent rhythm rather than trying to move around on the calendar. This topic is one that I originally proposed because it is a topic that is very important to me. As part of our preparation for these meetings, we were asked to attend 2 roll call sessions and perform a ride-along. When I did my roll call, I had some time after the roll call and engaged in some discussion with Sergeant Catherine Gordon. During that discussion, the topic of mental health came up, and I was somewhat surprised with the depth of the conversation that ensued. That topic would go on to be one that I would hear each time, and I was not prompting the conversation. Why is mental health so important, such an important issue to me? I have dealt with mental health in people I know and love. I have seen how mental health affects someone and how it changes them in their behavior in ways we would normally think impossible. According to a study in the Washington Post, 23% of people killed by police officers displayed evidence of mental illness. A study released by the Treatment Advocacy Center reported that people with untreated mental illness are 16 times more likely to be killed during a police encounter than other civilians approached or stopped by law enforcement. The study went on to say that while fewer than 1 in 50 adults in the U.S. have untreated mental illness, they are involved in at least 1 in 4, as many as half of all fatal police shootings, the study says. No quote would be more relevant and important to be heard than this quote from the Treatment Center study. By dismantling the mental illness treatment system, we have turned mental health crisis from a medical issue into a police officer matter, said John Snook, an executive director and co-author of this study. This is patently unfair, illogical, and is proving harmful both to the individuals in desperate need of care and the officer who is forced to respond. I am thankful that Madison sees the importance of the crisis intervention team and having officers with mental health officer training. We don't have the power to reform the mental health system. However, we do have the ability to equip our officers with the best training and resources to help them deal with this near epidemic situation. Perhaps our officers trained in mental health can help us all understand ways that we can better deal with people experiencing mental health crisis. We as citizens, sons, daughters, brothers, and sisters must also be willing to shoulder some of the measure of the burden of care. This will help us in reducing the number of interactions and potentially saving lives. We'll move on to District 4.
No report.
Report. Thank you, Frank. We'll move on to District 5. Dwayne is not present this evening. I'll move on to District 6. Rebecca.
Thank you. I have a short report. It's something that was brought to my attention just an hour before the meeting. I did get a concern over praying before our meetings and wanting to make sure that our committee sticks to our mission of including everyone in our community. So for the sake of inclusivity, we will reach out to a variety of faith groups. If anyone is interested, please contact anyone on this committee. We truly want for everyone to feel included in this process, in this committee. We care for everyone, and we want you all to feel comfortable.
Thank you, Rebecca. District 7. Arthur.
I have nothing to report.
Thanks, Walter. Rajiv.
So, actually today, this afternoon, something was brought to my attention. There's a potential dispute was between this person who contacted me and somebody who lives below her, and above her, and this family was making a lot of noise, and this family happened to be Hispanic. So her comment to me was, well, first of all, it's not gotten to the point where police intervention is needed. They're trying to work out the issues themselves, but she's saying, I'm hesitant to involve the police because given the record and what happened on an incident a few years ago with a grandfather who was, brought down physically, that she thinks, and this is a Caucasian lady, she's thinking that the Spanish people will not be treated very well. And her concern was also, is there somebody on the force who speaks Spanish? So that's kind of was brought to my attention this afternoon.
Thank you, Ron. I guess the only thing that I would talk about this evening is, as we prepare to talk about mental health, I just think it's something that I'm just not sure we talk about enough. I'm not sure that we realize how close it is. I'm not even sure that we realize that some of us may be dealing with some of it every single day. And I think that it's very important in order for us to be able to move forward when we're faced with issues, problems, and concerns. But you first got to have a conversation. And it's always best to have that conversation with someone with some educational background and knowledge versus just everyone having their own opinion. And I'm very pleased that we were able to bring some of those individuals in here tonight to talk about mental health concerns. And I think that's very important. And I think this is just one of the many things that we as a community can work together to help everyone out. That's those individuals that are dealing with those mental health issues, as well as our law enforcement who are traditionally the first ones called to deal with those issues. So it's something that we both, when I look at it both, that's everyone working together to help resolve it. So with that, I'm going to go ahead and that'll end my report, and we'll move into old business. Is there any old business?
I don't know if this is old business or not, but it's talking about how we are going to operate as individuals and as a committee. So maybe stop me and start getting off track. But Rajiv, you saw the email that I sent back, and I think that when we receive an issue or a complaint, that it's incumbent upon us to get to the bottom of it and not act on perception or hearsay. And my whole life, my previous career has always been, give me the facts, and then I can really assess where the issues lie, and then we can start figuring out how better to, whether it's promote communication, bring something to the chief's attention, or whatever, get the committee together to discuss it. So I appreciate that individual coming forward to you, and we all know about the incident and stuff like that. But I would, when I get asked by individuals, and I start asking a series of questions. So I start drilling down. Is this a perception? Did you actually call the police department and they treated you wrong? They didn't show up because you're Hispanic, you're East Indian, you're like me, Irish Catholic, and they don't like us? I mean, I don't know. But, I start start drilling down, and then we can find out where the issue is, and then I think we can come together, and like Marcus always talked about communication, then we can figure out what's the best course of action. And the best course of action may just be bringing that individual over to talk to these wonderful police officers here that protect us every day, every night, type of thing, and just do that type of thing. So anyway, I just think that we as a group need to not be bouncing all over the place on hearsay, perception, I always say cage and hold as a pilot, get that attitude indicator, boom, solid, and let's ask some questions so we really know where the issue lies, and then I think we can be more effective committee. And that's my 2 cents on the whole business.
No, very much appreciated. Does anyone have anything else? Well, I'll just give my comment. I was kind of confused initially in where I bring this up at. Because, Raji, you have a and it is something that we should discuss. And one of the things when we started talking as a committee was, as issues and concerns were brought to us, working through exactly what you're saying, Kurt. And that's working through what is, okay, someone said something, how do we get to the base of that? And what is, my whole upbringing is let's search for the facts. And then as we get the facts, we're able to put that together, then we can put something together and bring it to the proper, put it in the proper channel that it needs to be worked in. So I think in this particular situation, what I would like for you, Raji, to take a look at this, to gather some more information, and then let's bring this back so we can find out where the disconnect is. And then from there, we can work to find out how we can provide a solution for this. That would be my recommendation. And for this one particular one, we talked about doing this in little subcommittees. So if Raji, since it came from you, I would like for you to lead it, but feel free that myself and others in the committee are more than welcome to assist in helping gather that background information.
Absolutely, and my intention was to dissuade her concerns, but due to the timing that this just happened a couple of hours before the meeting, I didn't get really the time, but I'm going to be meeting with her again, so.
I think this is good because this gives us an opportunity to talk about procedurally how to go. And Marcus, I don't know if there's, as the committee members give their reports, if there should be a time to have open discussion. So I could say, hey, Arthur, look, give us a little bit more on that. It's a reading a report, but we're not getting the meat or the gist of it. And he or Frank may have deeper meaning. I don't know where that would be in new business, old business, but that may be helpful.
Well, one way I think we can address it, and this is something that we can go back and look at it, is I think that if a concern pops up in a committee report, if the committee member is not able to provide it earlier so we can add it to the agenda, then maybe we can add it as a new business item to discuss. because I think it's important because I think it's what we also want to make sure is not, oh, this thing came up and we just swept it under the rug. Oh, they'll talk about it sometime in air quotes, and we don't want that. One thing that I'm very happy with is that as a committee, we're very much willing to listen to each other, and we all have different opinions and different perspectives. And I think that's what makes the committee work well, and how we see things are not all alike, which is good. But I think with that, you get a much clearer understanding because we're not in groupthink. So I think as we move forward, and what we'll do is I'll go back and look at it from a procedural perspective on adding it in new business. But right now, the way that I think it should be is if something comes up that should be discussed, or you had a question about, we should bring it back up so that those questions are answered and we have much more clarification. Great point. I appreciate you. Okay.
Could I just
Absolutely.
comment there? I completely agree with the idea of drilling down to get together all the facts when an issue is raised. But I'm going to suggest that we be very careful in our approach, and such that it doesn't come across as if we are attempting to showing our position in terms of whether we agree or not agree with the issue that's raised. So let us be very careful in our response, in our effort to gather that detailed information that will better allow us to bring that information back to our committee, discuss it, and formulate some kind of response. Because it's very easy for, I think, people to get a perception that we may or may not. We gotta sell to the public that we are here to be an avenue for their voice to be heard, and we just don't want to send them the message that when they voice a concern, they get an impression that there's some degree of a proposal to it, or they've been interrogated about it, whatever the case may be. So let us just keep that in mind as we go forward. But I love the idea of drilling down for the detailed information, because that will allow us to make the better decisions for responses. So I just want to add that comment.
No, I 100% agree with you, and I think I chuckled a little bit because I think in some of my past life, one of the jobs I had was you had to go out and get you had to be the unbiased resource to go gather information, the facts, not opinions, not perceptions, but facts. And I think, but you also bring up a very good point. We have to make sure that we don't come across as an adversarial. I need this information now. I think we want, and I think the initially when we talked through was creating our forum that we had talked through, so that a person would not feel as much intimidated by it. But I think we got to make sure we get that forum up and running. And I know we're working with IT and everyone to get that going, and making sure that we can also pass that information out to everyone so they understand it and also are able to utilize and have access to it. But we also 100% agree, we don't want it to be that we're not law enforcement officers, and our job isn't to go out and do detective work. We should be going out to gather facts, which anyone can do, to gather facts and bring those facts back. We have 9 people that are able to look at that information, and then from that information, we come up with, as a committee, what we recommend to move forward.
And you can do that in a caring, compassionate manner.
Exactly. That's the way, I'm glad you said that, Curtis. That's the way we should do that. It should be that we are going out as an assistant, not as we're digging into somebody. But great comment. Any other comments? I appreciate this.
I completely agree. Objectivity is very important.
Yes.
We want to be someone they can come to, someone they trust.
May I ask one?
Not yet, please. I'm sorry about that.
Questions?
Okay, with that, is there any other old business? Okay. With that, I would like to move into new business. And at this time, I think we have some experts in the building that I would love to come forward to talk about the crisis intervention training as well as the community mental health officer program.
Good evening. I'm Detective Bryce Tates. I've been an employee with the city of Madison for 9 years now, an officer for 7. Detective Thomas is our lead crisis intervention representative over the team, and I kind of shadow her. I also am a community mental health officer for the city, or for the police department, and I'm also part of the crisis intervention team. All of our community mental health officers are crisis intervention officers, and there's a difference between that. And this is Officer DeFazio. She's here with me tonight. Officer DeFazio is part of the SRO unit with the police department, and she's also a community mental health officer. She's going to cover a PowerPoint over the intervention team. I've also got some PowerPoints here, or some pamphlets here that I have, hopefully that the community can get. I believe I've got enough covering our intervention team and also some resources that we use. So bear with me, I'll pass those out.
I'm Officer DeFazio. I'm a community mental health officer as well as CIP. So first I want to go over what CIP stands for. It is Crisis Intervention Team. You can recognize us with the such as blue CIP patch on our vest. Crisis, we do talk a lot about mental health, but all of us can be in a crisis. You can have a really bad series of events, which brings you to a crisis where law enforcement is involved. So Crisis Intervention Team encompasses both mental health and crisis, so it's every crisis. The history of the CIT, it started in Memphis in 1988. It spread throughout many countries and many jurisdictions. It's a partnership between law enforcement and healthcare and other mental health advocacy groups. We work with a lot of local resources within the community, some private companies, to get people with mental health issues that don't have any resources available to them, to get them in touch with the right people. Our CIP officers are trained to problem solve between the criminal justice system and mental health care system. We try really hard to jail diversion. If they're not, jail is not the place for them. If you respond to a call and we recognize they are in crisis, it's working between the two systems. Getting someone who needs help, the help that they need, versus someone who has broken the law and needs to go to jail. So separating the two and getting people the help they need. Memphis realized that after the start of their program, their number of rearrests decreased by 58%. After the introduction of CIT in Memphis, officer injuries sustained during the responses to mental disturbances, they decreased by 8%. In Albuquerque, police shootings in the community declined after the introduction of CIT. The CIT program, we have achieved a triumphant success and it's been adapted in over 2,000 municipalities in over 40 states. We do use the Memphis model. It is referred to as the gold standard. Our main goal when we're on a mental health call is to de-escalate first, assess the situation, and try to get the person in crisis the help that they need. We have 10 right now members on our CIT team. They're on all shifts. We have 3 in the schools to help juveniles as well. I know we talk about adults a lot, but we're experiencing it in the juvenile world. And it doesn't seem to be going Our officers have undergone at least 40 hours of specialized training. They're taught and trained to identify serious mental illness within our community and how to respond to that. Identifying the mental illness is key when you're on call like that, and it's designed to reduce the stigma around mental illness. I've already seen a huge reduction in the stigma, even with our officers being trained as far as in the community, and even with some family members of people with mental illness. Our officers have been trained to direct individuals and their family members to the resources that they need in the treatment program. So we have a graph. Their numbers from 2017 up until present. This year is not over, and we've well exceeded our reports, our total mental health reports. This is not the amount of calls that we receive. This is the amount of reports that have been taken as a result of the call. 2017, it was 111, and already right now this year we're at 229. It's a need that's not going away, and training and how we deal with this. I think Detective Kate is going to speak with you about the mental health officer program, CNHO.
Billie, I just want to touch on these numbers listed here on this graph. These numbers are just reports that officers use as a mental health report that they generated. This doesn't include reports where they have went to a theft in progress or anything else, or a domestic related incident that they didn't do a separate report just stating the mental health facts. So this is just reports from our records management system that we pulled for just mental health. So what I'm getting at is these numbers can be a lot higher. And I'm hoping that with our new RMS system that we've been working with the IT department to be able to help us better track these so we get more accurate numbers. So I'd have to say that our numbers are probably a little bit more higher than what they are right now. That's going to conclude our PowerPoint. As far as our community mental health officers, we have 3 community mental health officers currently who are active. We have a 4th one who is pending right now, who is on night shift. It's myself, Officer DeFazio, and Detective Thomas are the 3 active roles right now. We're available to all shifts, all police officers 24/7. They're able to call us, and we are the representatives that directly contact all of our that work. We're essentially appointed by the probate judge, and we work directly with the probate judge and the court system for when we take our mentally ill down for treatment. We follow that individual from start to finish, and we go to the hearing with the families. They try to come up with different programs within Wellstone. We're in partnership with Wellstone. On the blue pamphlets that you can see that we have NAMI that we can use for different resources. Wellstone's the biggest one, and right now they have a new facility called Wellstone Emergency Services where we can try to get all of our mentally ill treated immediately. They're not fully operational 24/7 yet, but they're on a schedule. But as soon as they can get that up and running full 24/7, we'll be able to take them directly there and bypass the hospital. Because what happens is the hospital goes down, we take a subject down to get treatment, and they end up getting released. And it's hard to follow them. So they get the immediate care that they need right then and there at the WES facility. I've been told this time next year that they'll have the center up and running 24/7, which is right next to Golf Road, next to Wellstone, or off Golf Road, right next to Wellstone. So the new development that you see, that's where the new facility will be. And officers and PMZ and all of us will be able to take all of our mentally ill that we give the CIT officers the authorization to transport straight to that facility. I would like at this time to be able to open up the floor for any questions. And I'm not a perfect person. I will try to answer everything that we can. If we can't, we'll be sure to get back with you, I promise.
I had a couple of questions. And I don't know if you're able to do this or not, to provide us the demographics of your 229 so we can kind of see, as we've been experiencing COVID for the last 2 years, a lot of mental health issues. Now we're seeing that in a younger population than what we normally would have. Again, I don't know legalities, if you even can, but I just kind of like to see what are the demographics, age, and those sort of things for the population to start determining if there's a population at risk. And so as we're reaching out to our community, we can kind of gather some more information on that, if it's possible.
Yes, sir. I'll note that and I'll try to see if we can.
Congratulations, Detective. You've come a long way.
Thank you. Appreciate that.
And also, I mean, I do want to comment on that. I think everyone is at risk. It doesn't take mental health and mental illness having I mean, you think, oh, someone was born with mental illness, but it can happen to anyone through a series of events in your life. So we can look into getting those statistics, but you know, it affects everyone. So I don't know, but we've seen a certain
You talk about demographics. With the pandemic, have you seen a lot more younger people who are going through, well, I guess I could call it emotional stress from what you've seen before the pandemic?
Yeah, and I think this generation is a big advocate for that, especially in the schools coming just recently from as the SRO unit at James Clemens High School, just alone in that school, having an uptick in just juvenile, suicidal threats and things of that nature have been an uptick, I believe, since the pandemic. So, but as far as like an age range in our adolescents up to the, I would say early 30s, there's an uptick in it. And it can even be drug induced also, people who are using narcotics.
And we're also starting to see it in younger and younger ages. And not sure if it's social media, there's a lot of different areas where they can't escape the bullying. It used to be when someone bullied you, you just went home, didn't have to deal with it until the next day. Now it's always in front of them. So we are seeing it younger and younger. I don't know if it's related to COVID or not. Probably a lot of factors.
Yes, sir. Just a question regarding the training. I think you mentioned something about 40 hours of training. Is that training specifically for your team right now, or is that training throughout the force where there's going to be some annual type 40 hours training per officer?
So right now, our crisis intervention team is all voluntarily. So we don't have, if the officers don't want to do it, they don't have to go to the training. I think that we might get to the point where I've just heard from talk that they want to get everybody trained for CIT. But currently right now, it's just people who want to go. I believe in this capacity, if you don't love it, then you shouldn't do it. Because you got to have an open heart and you got to be able to care and to be able to get one-on-one with families and that particular individual. And if you don't have the heart for it, in my opinion, you shouldn't do it. But the 40-hour training, all of our officers currently go over to Huntsville, we're in partnership with Huntsville and the county sheriffs, and we all have, there's a couple of training sessions a year for new CIT trained officers to go to. As far as continuing education credits, or however you want to look at it, or our CEUs, we do training throughout the year for every officer with certain PowerPoints and things that other officers have put together through the training unit. Specifically for me, I've been through 2 40-hour blocks. I went to Memphis and actually sat through their actual CIT program in class that they have, and then I came back and did the one that here in Huntsville for the partnership. And then of course all of our community mental health officers go through training directly with Wellstone, and those officers actually get to go out into the communities, not so much here in Madison, but they have those group homes where the mentally ill are there in the state, they're in state housing, and they have teams who go out and treat those individuals every day and give them their medication and things. So Officer DeFazio and I actually have done ride-alongs with Wellstone, going through that training and went out to the communities in plain clothes with them, to include the downtown rescue mission in our homeless population. So it gets pretty intensive it's out there if you want it. Yes.
So I have a 2-part question. First part is, are there any resources that you think would be helpful to you that you don't have? And specifically, I also want to ask you if you think that 3 pending 4 CIT members, officers, is enough.
3 or 4 mental
talking about 3 or 4 community mental health officers.
Yes, sorry.
So our community mental health officers are actually like a whole separate portion from crisis intervention officers. Essentially, a community mental health officer has the power under the probate judge to take somebody against their will who doesn't want to go to the hospital. It's the easiest way to explain it. And we can have them on orders down there. So as far as having enough resources, it does get tiring at times. You know, you get calls throughout the night, 1, 2 o'clock in the morning, but right now, I think we're at a pretty steady number for the time being as far as community mental health officers. Now, CIT officers alone, I think we're a little thin. And we're trying to, you know, encourage officers that want to go to the training to go to the training so we can have one on shift, fingers crossed, you know, all the time, every shift, days A, days B, nights A, nights B. And of course, Officer DeFazio and I are available during normal business hours while we're here working our 40-hour schedule. So Officer DeFazio has been pulled out of the schools at times as she's works in elementary mostly, so she's very mobile. So she can always revert back to the road if we don't have a CIT officer available on that particular shift during the day.
But as far as having enough resources, no, we can never have enough. I learned about a new partnership, you know, once a month, and when I do, I'm so excited because there's those calls where they don't quite meet criteria to take to a hospital, they're not in that emergency need, but you know they need something. So it's a struggle trying to find the right partnerships and resources within the community. So you can never have enough. Right now, juvenile, I mean, I would love to have some more juvenile resources. I don't have nearly enough because, you know, they're experiencing so much and they're young age right now, and I just, there's not a whole lot available.
Yeah, essentially they have no pediatric beds down at Huntsville Hospital right now for any of our adolescents. And all of those are referred back to the Nova Center, who's part of, is in partnership with Wellstone. That's for the adolescent side of Wellstone.
Thank you both for what you do. Thank you for being here tonight.
It just seems, and it's kind of going along with the previous question. Maybe it's something that we all have to look at, and it's just the manpower. Because I thought I heard that if you had to take someone to the facility, then you're with that person, with that individual, and if something else is going on, then they have to call you or they have to find someone else. But meanwhile, I'm under the impression, and maybe I'm wrong, that you stay there until not mission complete, or they're good to go, but until that situation is mostly resolved. I use air quotes, mostly resolved. So then it just seems like as we move forward, and even as you brought up with our youth, it seems as though it may be something that we're going to have to really take a new look at as far as resources on how do we make more of you. How do we duplicate you, and how do we duplicate you so that we have those assets available? Because it was going to be one of my questions, but I figured it'd be too much. Like on an average day, how many mental health cases are how many times are you called for an issue that's dealing with the mental health situation?
Officer DeFazio and I talked about that prior to this meeting tonight, and I said I believe that's going to be one of our questions, and it's almost impossible for me. I'm not going to say it's impossible for me to answer because we just never know what's going to unfold in the city. Anything can happen at any given minute. We may have somebody who's homeless that just wanders off into our community, and we have a citizen who calls in and says, "Hey, he's riding down the middle of the road on a bike." Not anything's wrong with that, but we get out with him and we start assessing, and maybe he's mentally ill. So it just kind of depends. I would love to say that we run 5 or 6 a week, but it all depends. It all depends. I really have no definite number.
Well, and then my other concern with that is, as we move closer to these things called the holidays, traditionally that can be another time in which people deal with situations and concerns differently. So to me, it seems like we may need to eventually look at some more manpower and assistance, some additional resources for you.
Yes, sir.
That's all. Thank you again for, I think there's a question. Yes, sir.
Just yesterday, I read a report that addressed the severe lack of training of 911 operators when it comes to mental health issues. What training do we provide to our 911 dispatchers to deal with mental health issues?
That's a great question. Our CIT program, in partnership with Huntsville and the county, we actually have CIT trained dispatchers. I don't know, I believe we have one left in our agency currently, but don't quote me correctly on that. But there is training for those dispatchers to be able to go through the same training as us. So if that subject calls in, they'll be able to detect, or be able to at least figure out that something's just not quite right.
Is there at least one per shift?
Currently not right now.
I had a question.
Yes.
And I don't know if it's going to be kind of like a future question or maybe something that's already in the works, but to help with manpower, are civilians incorporated in maybe answering calls with?
So that's one reason why I stepped up here. I want to give you a preview of things to come.
Okay.
Thank you. So first off, I wanted to thank the office here. I wanted you guys to see the kind of dedication and professionalism that the police department has with officers like this. And I wanted them to speak first so you can see and hear from them. So just wanted to follow up with a couple of things. The dispatchers. So some of our long-range plans with CIT, I want to make sure that we have at least 35 to 40% of our officers CIT trained and certified. Unfortunately, not every police officer makes a good CIT officer. I'd like to say that that's true, but it's not. The reason why we have this Memphis model is because it is the gold standard for CIT training. But one of the things the Memphis model emphasizes is that the officer has to self-select. They have to volunteer. You can't make everybody do it. And one of the things that happens is once they get certified, they do get the patch or the pin on their uniform that signifies they are a CIT officer. And we actually work with the mental health community, and we go out to places where mentally ill people may be housed. And they are taught that if you are in crisis and the police show up, look for that officer that's wearing that on their uniform. And that's who you want to talk to. And if we put the wrong person out there with that pen or that patch on their uniform, we have a bad encounter, it ruins our entire program. And we don't want that to happen. So it is a self-select program, but our plans are to get at least 35 to 40% of our officers CIT trained and certified so that we have them available 24/7 for each of our shifts. And we have multiple officers, because as it stands right now, we have too few and they're being overworked. The question was asked about the amount of mental health related calls we have. I get something called an interwatch report every shift from the outgoing shift supervisors advising me of everything that happened in the police related in the city that particular day. And hardly a shift goes by that we don't have at least 2 or 3 mental health related calls. The question was asked about juveniles, if we're seeing juveniles involved in mental health issues. Yes, we're seeing more and more of those with those mental health related calls. One of the things that, again, more of the previews of things to come, hopefully, is we've been in touch with a group out of Boston called Strategies for Youth. And they teach a course called Policing the Teen Brain. I can't speak, sorry. Policing the Teen Brain. And a big portion of that is a section on juvenile mental health issues that I'd like all of the SROs to go through. And we're trying to bring members of that group here to teach our own officers to become, essentially it's a train-the-trainer program, so that we can have our own trainers in place and be able to train the entire department after that. But the SROs going first, provide them with that specific mental health related training that's geared towards the unique aspects of mental health in juveniles. That's different than it is from adults. What we're seeing a lot of now also with COVID, the lockdowns, the isolation, there's a lot of depression related mental ill calls, and also a lot of, with the juveniles, a lot of anxiety related mental health calls. And again, we'd like to get that specialized training. So We look at the things that happen in society. Nobody calls the police because they're having a good day. It's that simple. The best thing we can do is when people are having that bad day and they call us, they're calling us for a specific reason. They're looking for an answer to their problem. And we have to prepare our officers to be able to answer those types of calls. So again, that's one aspect of it. The other aspect is, again, if we can get more of our officers trained and CIT certified, that will help out the officers that we have now, plus provide better service coverage to the public. The dispatchers, we have a plan to have every dispatcher CIT trained because we want that CIT service to start the minute that phone call is answered by the dispatcher. We went all the way through an officer is dispatched until the situation is either resolved or that person is taken to a mental health facility where they can get further treatment. Not everybody has to go when they call. And not everybody that we deal with is mentally ill. We also deal with people that are in mental health crisis. So one of the great aspects of the CIT training is that it teaches us active listening and de-escalation techniques. And that's where it's a good training for every officer to get, because every officer needs that de-escalation and active listening skill, whether they're a CIT officer or not, because those skills work in any type of situation, any type of stressful situation that we're called to. Right? It can work, when you're talking to your wives or husbands. I've used it with my wife before a few times, because you're using that CIT stuff on me again, stop. So these are, again, some of the things that we have coming down the road. We want Madison to be the focal point here in Northern Alabama for that type of training. We do take it very seriously. It is a large part of what we do. If I may, I'd like to address the issue that you brought up earlier, Mr. Sharma. Another initiative we have going on here in Madison. A couple of weeks ago, members of command staff, some of the SROs and I met with members of the Madison School Board, or not the school board, but school teachers, that deal specifically with the kids that are here that speak very little English or no English at all. We found that over 8 different languages are spoken in our city, in our schools. So we reached out to the school system to help us understand exactly what type of cultures we're dealing with, where people are from here, and how we can best reach those communities, because those communities tend to cluster together when you're in a strange place, and how we can reach out to those communities and provide them with information on how to receive these services should they need it. And one of the aims of this program is we also want to find people from these different cultures that are willing to come out to our police roll calls and teach our officers something unique about their culture. One of the things we don't want to happen is that they do call for police service and we don't understand the culture. We go there and we stand the wrong way, we put our hands on our hips, we talk to the wrong person, and we immediately shut down all communications. So if we understand a little bit about these cultures, the officers will be better prepared when they respond to calls dealing with people that aren't from this country originally. But we owe them the same amount of professional police services as anybody else. So we're also asking for members of those communities that are willing to come forward and act as translators and interpreters for us should we have an issue and come across one of these citizens that doesn't speak English. And I don't want that communication barrier to lead to something nasty between us and them. I think that's what happened, the issue that you referred to several years ago. The communication barrier led to something very unpleasant, and I don't want to see that happen again. So these are some of the other things that we're working on in the police department. So please let them know that as well. And yes, we do have several officers who speak Spanish.
I'll definitely relay the information.
If there's any other questions or comments?
Was there any other questions or comments?
And if you could touch on the question I asked before in regards to civilians being able to help with answering calls.
So I would say no as of right now. We're looking at liability issues. Now sometimes, we have to be honest, sometimes these calls that we go to involving mentally ill persons can get violent. And that's the last thing we want. We hope that the active listening and de-escalation skills can talk them down, but there are times where we have to go hands-on with somebody. One thing we are looking at though, Huntsville has started this, we'd like to do the same thing here in Madison eventually, is have something known as a mobile co-responder unit, where we actually have a mental health professional writing to the police and they can respond to mental health calls and immediately assess the person at the scene and determine what needs to be done from there. But our ultimate aim with the CIT program again is to lower that stress level when we get there, talk that person down, see if they actually need some type of service. What we want to do is disconnect them from the criminal justice system, because in the past, with the very little training that officers have had traditionally with people who are mentally ill, we referred to that straight criminal justice model where we put them in jail, and that's the last place that people, somebody who's mentally ill needs to be.
Thank you.
Well, I want to thank the officers for coming on. Really appreciate your time. Definitely appreciate the information that we will do our best to continue to push that out to the rest of the members and within our community. And thanks, Chief, for the update. We greatly appreciate that, and know you're on board and you have a vision of where you want to go and what you want to do, and we appreciate that as well. Now we'll move on to Resolution 2021-002. Is there a motion on the floor to accept the public comments policy?
I would do that.
It's been moved and properly second to accept Resolution 2021-002. Is there any discussion?
What's the resolution?
The resolution is adopting the public comment policy for this committee. It is the policy is very similar to the city's policy, based off of information that they've received and the studies they've done, and we're pretty much adapting something very similar to the city's public comment policy. The policy will be published, so everyone will have access to review and go over that policy as well.
So, question then for discussion. So as we're not engaged in dialogue with the Q&A with the speakers, do you see that, or does committee believe that after we're adjourned, we can talk with that individual to gain more information or perspective that's required? I mean, we listen and then we're done. There's no more interaction that evening while the topic's hot with that person. What's our thoughts?
Well, the idea is that the chair assigns someone to formally respond to, gather information, and also formally respond to that person. And then report back to the next meeting on. And that's
Yeah, no, I heard that. Okay, well, my thought is sometimes it doesn't require formal, it just requires, someone has a question on masks. There's a policy, Madison mayor has put out a policy on masks. So there's some discussion that can be happening after that doesn't necessarily require a formal to do this. So are we saying that we're not doing that?
No, there's nothing prohibiting continued dialogue.
Okay, thank you.
That's just saying for the purpose of that section.
Of that section here.
That's not what it's for necessarily,
okay.
But of course.
Yeah. Okay.
And I'm going to go out on a limb here. I think that if it seems as though there's a question that we can ask, or there's a question that's brought up, and we can address it here, and talk about it, we'll be able to say, hey, we're going to go ahead. Yes, sir, ma'am. What about this or what about that? And then we say, okay, and we have the conversation and we say, okay, it's because of A, B, and C. And then we're able to do that, but I think what we're trying to,
I understand what we're trying to get at.
Yeah. No, I agree, great point. And I think that understanding that this is the policy, but we do have I believe I have the liberty, and we as a committee have the liberty to entertain that if the situation arises that we really need to, and the conversation is such that we need to continue so we can get resolution. We have that liberty to do that. Okay. And I love this. Thank you.
You know it's coming.
I know what's coming.
Before years,
Yes. Thank you. One more. Yeah, give it to me. Any other discussion? If there's no other discussion, would I like to move forward with a roll call vote?
District 1. District 2.
Aye.
District 3. District 4.
Aye.
District 5. District 6. Aye. District 7.
Aye.
Rajiv Sharma. Marc Highsmith.
Aye. Motion passes. Well, resolution passes, excuse me. Is there any other new business?
We need to discuss the topic of our next meeting and also the date that we're going to have that meeting. I'd like to bring to the attention of the committee that the date for our next committee meeting would normally be, let's see, on the 29th? No, sorry, the 30th. What would that, no, I'm sorry, 1, 2, 3, the 23rd. The 23rd would normally be our date for our meeting, but that is Thanksgiving break that week. I don't know if anybody's going out of town, but I thought we could take it into consideration and possibly meet on November 16th. Or whatever date works.
No, good. We need to. Meaning, I know, unfortunately, I think I will be out of town on the 16th. I mean, the show still can go on, but I know, I know I will be here on the 16th. I will be here on the 23rd, though, but I will be here on the 16th. What about the 30th? That's good. I know it's a little further than what we normally would do.
I don't see a problem with pushing it out further if we can pull it in closer.
I would like to hear from the other members of the committee. That's Mr. Fletcher.
I think we can move further out.
Mr. Brackett.
I'm flexible. Whatever the majority of the team suits fits best for the majority of the team, I can do either the 16th or the 30th. So.
Okay.
Motion.
Either one works. 23rd, I'm out of town, so either good.
Yeah, actually, either one is fine.
Okay, so we're going to move it to the 30th. So our next meeting will be 30 November. Now, I had a couple ideas. I know we had talked about a couple things before as far as what our next meeting will be, but I really need, I'm going to make a phone call. I need to talk to the chief about, because what we talked about another time was talking about CALIA, and maybe having someone come talk about CALIA. CALIA is something that we talk about, and we talk about what that means. I think maybe not enough people understand the quality of that certification. And Chief, I don't want to put you on the spot. That's why I don't want to knock that in for that topic. So if I could, I'll send you a note and we can talk through it. And if that's doable, we'll do that. If not, I will within a week give some suggestions and take suggestions for what our next topic should be. Everybody okay with that? Okay. With that being said,
Move to adjourn.
it's been moved and properly seconded to adjourn. Is there any discussion? Meeting is adjourned. Thank you all for